the situation is that say I was a husband living in a home, and I was outside mowing the yard, and I turn off the mower. I hear my wife call for help. She's fallen and cut her arm on a sharp piece of metal while moving boxes in the garage. Pretty normal thing that would probably happen. And so it was my wife. So I'd have an obligation to perform first aid on her as per the rules of a first aid giver. And so my first movement would be to take off clothing that might get in the way of gloves or might have dirt already on it. And I would do this quickly, and then I would wash my hands, clean off any dirt, probably up to the elbows as well, because she did get cut on her arm, and there are several large veins that goes through there, so it would most likely be bleeding heavily, and I would have already gone past her and checked on her. I come back and check and make sure, and it is bleeding quite a bit, not super fast, but still a potentially serious bleed. So I would then put on the gloves, and these gloves might be a bit small for me, but still they'll work because they shouldn't break. And then something else that'd be useful, I might be wearing something like this as I'm mowing the lawn, but then I'd probably put on something fresh just because there is blood and there's a chance that it could spread. So I'd put this on my face to keep my mouth and nose covered, and if I had any eye coverings, I'd most likely wear those as well. And there's plenty of time, like the textbook says it does take at least 14 minutes, I believe. Yeah, 14 minutes for someone to fully bleed out, and it's bleeding slowly, and she's a healthy person, so that she's most likely a healthy person, so her platelets would already be trying to close the gap, and the vein would be contracting to reduce blood. Then you would take a hemostat dressing that you have, and I don't have one, so this napkin here is going to be doing in place of it. And I'm going to go ahead and release these bandages, because I'm going to be using these to secure the gauze. I did have medical tape, but it has since disappeared somehow, so I'll use 2 large bandages to secure the gauze in place. Alright. Okay, and then we're going to take the hemostat dressing, which has a chemical on it that would also help reduce the blood flow. Then I'm going to take the gauze and start wrapping it around, and keeping pressure on the wound to also further reduce blood flow. And I'm going to wrap it several times around just to make sure it's nice and thick, just to give some extra absorbance to the dressing underneath, to give extra time for if it further bleeds out. I do not have scissors. All right then. Hold on one moment. I'm getting something to cut this. I'm gonna leave this right there. And in the rush to not get scissors, could you turn the camera back? I would most likely not, because the situation would be stressful, because it would be my wife or my girlfriend who actually is holding the camera, just off the record. But I would most likely grab a pocket knife out of my own home, because there would be one nearby. And then I'm going to take the Band-Aid and right here, and then put it across to secure the end of the gauze, and then that would hold it in place for the moment. And I do have an extra one right here, which, let's see, it does look fairly secure, but I am going to put an extra one just in case. Better safe than sorry. And then I'm going to put it this way to secure this end, so I have tape going all the way across both sides, so it would secure it. And then now that it's secured, and the wound would have been washed before this, I'd forgotten to mention this, But we would have washed the debris out with either soap and water or an alcohol wipe, and then put this on. And then all this material would most likely be contaminated because I touched it with gloves. And gloves actually did break. But then we would use the previously mentioned tactic of pulling the glove off, then gripping the outside with the glove that's already contaminated. And then we would take 2 fingers, go inside of this glove, pull it out, and then this way everything is on the inside. And then these most likely would have been thrown away before I took the gloves off, because they would have also had material on them from me washing the wound, but these would have been contained biohazard as well. And I would have had the gloves on, putting these in a safe container that's sealed, then taking off the gloves. And then if my wife further needed a shot for tetanus or something like that, we would of course contact medical authorities, or since it's already bandaged, it wouldn't be considered as serious. I could drive her to the hospital myself, and that's how you bandage a wound.